Good evening, everyone. It's nice to see everyone out this evening, and I would just like to thank you for taking a few minutes out of your day to spend with us and talk more about the psychiatric mental health nurse practitioner program and role that we offer here at Frontier Nursing University. My name is Dr. Kevin Scalf. I'm the department chair for the Psych Nurse Practitioner program here at FNU. And it's a great pleasure to be able to come and meet with you and talk about our program, see what types of questions that you may have. That's what we're here for tonight. So thank you so much for taking the time out of your busy day to spend with us. We really appreciate it. Before we get started, I would like to take an opportunity to introduce or have them introduce themselves, some of my colleagues here at Frontier, and just kind of briefly describe what your role is in this process. And so I see several of my colleagues on the call. So if you guys could just take a moment and introduce yourself.
Thanks, Dr. Scaff. I'm Stephanie Boyd. I'm the Director of Clinical Outreach and Placement Services here at Frontier Nursing University. And essentially, our team is tasked with helping students identify appropriate clinical sites and preceptors to get them prepared for their clinical experience.
And hello, everybody. My name is Richard Kolke. I'm here on behalf of the admissions team and glad to be here and glad to have everybody here with us. Thank you.
Okay. I think we also have Ava and Quincy. Are you here?
Yes,
we're both
hi.
here. Sorry. We're from marketing here at Frontier, and so we're just sitting in on the, sorry, my camera's off. There you go. We're sitting in on the presentation to record it for you all, and if you registered ahead of time for the Zoom, you will receive an email with a link to the email that you got your reminder for this.
Thank you guys so much. I would like to say before we get started, if you have questions as we go through, feel free to type those into the chat. My colleagues that are on the call will help me monitor those questions and help respond back to those. You can also unmute and just talk as well. This is really an informal process where we just kind of sit down together and we talk about the program. So the more questions that you have, the better the session will be. We encourage questions and communication. That's very important. So feel free to let us know when you do have questions, and we'll be able to help you get the answer and feel better about it. So without further ado, we will get started. And like I said, my name is Dr. Kevin Scalf. I'm the department chair for the Psych MP program here at Frontier Nursing University. We also have Dr. Susan Piper. She was unable to join us this evening, but Dr. Piper is our clinical director in the program. And Dr. Piper plays an important role in overseeing the clinical practicum and also supervises the regional clinical faculty members that oversee your clinical practicum experiences. So she's not able to be here this evening, but you will get to know her pretty well as you advance into the program. Just to kind of start off, giving a little history about who we are at Frontier. I always like to show this photo because there's really a few things that you can get from this photo. And it really is directly related to our mission. When you read our mission statement here at the bottom of the page, there's a few words that I always like to just place some emphasis on because it really does speak to what we do each and every day. And one of the first words that I see in this mission statement that really speaks power is the word accessible. That is very important to who we are at Frontier and what we want to accomplish. We want to make advanced practice nursing education accessible to individuals because we know that if we can help provide the education and you go off and you start working with patients in your areas, the community's health will overall improve. It's long been documented that when nurse practitioners are able to function at the fullest scope of their practice, the health of the community improves. And so that's one of the things that we want to do here at Frontier is we want to be able to offer you accessibility so that you can participate in our programs and deliver care to your community. The second word that really pops out to me is integrates. Not only do we want to be accessible, but we want to integrate principles of diversity, equity, and inclusion to everything that we do. That is such a strong foundation here at our university. We have a culture of caring that you will hear about probably later on in the session, but basically everyone is important. Everyone has a role to play, and everyone has their own vision. And we want to help you achieve your vision and really your goals and your ambitions. You're more than just a number here at Frontier, but you are an individual person. And we want to get to know you as faculty. We love to serve in the role of mentor, a faculty member just engaging with students about certain things. I have students now that reach out to me that have long graduated. We have that relationship and it continues to go on because they will email me certain questions or want my opinion about something and I respond back and we talk back and forth. That's just a highlight of who we are at Frontier. Although we are a distance education program, we want to deliver you the amount of intimacy with a relationship like that you would receive, if not better than, in a bricks and mortar institution. So we want to be able to offer the flexibility of distance education, but we want to get to know you as a student as well. So we want to integrate these principles of DEI because that's everything that we stand for. And we also want to transform the healthcare of our communities. We want you to be compassionate, ethical, entrepreneurial leaders in the healthcare world of today. We all know that healthcare continually changes, but we want to be able to prepare you for that as you branch out into your role. So that's really who we are at Frontier. In this photo that we have, you can kind of see everybody's in a circle. And this is on our new campus in Versailles, Kentucky. And during the course of some of these bound sessions where students come to campus for like an immersive experience, at the end of the day, we always like to just kind of circle up and create a presence, if you will, so that everyone feels safe, but they also feel safe enough to be vulnerable and talk about their thoughts and feelings. Whether you are just excited to be here and can't wait to start the journey, or maybe you're a little uneasy about things. Is this the right time for me to do this in my life? Or what if I fail? We always have those what if questions that come into our mind when we start off on something new. And this is a wonderful time to be able to just share with your colleagues and receive support. That's one of the biggest things that we love to do here at Frontier is give you the support that you need so that you feel supported. And if we can provide you the right amount of support, you'll be successful. And so that's just something that we do. It's something that we stand for here at the university. We value you as a member of our community. Frontier has been doing distance education for a long time. And part of our distance education process is the culture of caring that I just mentioned. And basically what the culture of caring is it really is a framework that we use that guides everything that we do and say during the course of a day. We maintain professionalism with each other. We want to provide support to each other. We want to be able to just be aware of things that you need. We want to be able to create this atmosphere of inclusivity so that you really feel that you have a sense of belonging to our community. This is just not something that we say, but it's something that we do and something that is lived out each and every day. And when you come on campus for orientation sessions, you will witness this firsthand. This culture of caring is something that is a really big part of who we are, and you will be able to see it. And one of the big things with distance education here at Frontier is you can use your community as your classroom, so to speak. And what do I mean by that? Well, once that you get accepted at Frontier, you come to campus for a orientation session that we call Frontier Bound. You come in and it's an orientation to the university. It's an orientation to your program. You get to meet your faculty. You also get to meet all of the people that's involved in your program and in your journey as you progress through. You get to speak with individuals like your clinical advisors, your academic advisors, financial aid. There's so many different people that you get to connect with, and they give you a broad foundational overview of some of the things that you will need to know and some of the things to help prepare you for entry into your coursework. So after you leave Frontier Bound, now that you have this orientation session and you kind of know what this is starting to kind of look like, you go back to your communities and your homes, and then you start to participate in your didactic coursework. At Frontier, the didactic coursework is front loaded. And what I mean by that is you take all of your didactic coursework first, and then you get to immerse yourself into the clinical experience. So that's kind of how that our program is set up. So you come to Frontier Bound to get an orientation, you go home, you do your coursework. After your last didactic course is complete, you come back to campus one more time for an immersive experience that we call Clinical Bound. Now, Clinical Bound is a time where you can really interact with faculty, get feedback, and really prepare to enter into the clinical practicum with your preceptor. During your didactic coursework, you really get a lot of information. You learn a lot of things. You gain a lot of knowledge. But clinical is a little bit different. In clinical, you start to gain some wisdom. And there's a difference between knowledge and wisdom. Wisdom deals with how do I use this knowledge that I have learned, right? How can I put this into practice in real time with real patients? And so at Clinical Bound, we help tie all of those didactic courses up for you. And we have simulation activities throughout the course of the week. We've hired professional actors that come in. They play the role of a patient. And basically, we see patients back to back all day long, just like you would in a clinic. You get a clinic schedule, you see the patient comes in, and they give you a chief complaint. You take that chief complaint, work it through the diagnostic reasoning process, ending up with a diagnosis, and you plan treatment, just like that you would in clinic. And as you do this, your faculty are observing and they give you some feedback as well. You get feedback from the patient. How did it feel to be a patient in your office today? So you get really a lot of feedback in a safe space so that you can do a really good self-reflection at the end of the week, identify things that you're really good at, and then also identify things that you want to work on before you start going into clinical with real patients. And then after you leave Clinical Bound, you're off into your clinical practicum, which is oftentimes part of your community as well. So that's kind of what we mean when we say that we use community as a classroom. You can study from the comforts of your home. And there are some periodic travels. There's a couple of times that you come to campus here in Versailles, Kentucky, to do orientation and then also to just help put everything together in that Clinical Bound session that I talked about. So again, I think this speaks volumes to the fact that we like to interact with our students. This is not a program where you just sign up and you never see anybody. We like to engage in teaching and learning here, and that requires communication. It requires us to be together, to give feedback, to receive feedback, right? We do value that here at Frontier. A little history about the role of the psychiatric mental health nurse practitioner. Really, I think we kind of really took off in the mid to late 90s as a result of the increasing need for mental health care across the nation. We all know that there is a shortage of mental health providers, especially in rural and underserved communities. So the role of the Psych MP came in to help fill the gap for that so that patients could actually have access to care. And over the course of the last few years, our role has evolved really. We, as psychiatric nurse practitioners, we assess, we diagnose, we treat, we evaluate our plans of care. We have prescriptive authority. We can also do non-pharmacological things like psychotherapy, group psychotherapy, individual psychotherapy. And so it's not all about the medicine with the Psych NP, although that is a lot of what you will end up doing. It's just not everything, because I often tell students not every problem is a medicine problem. And so we want you to be able to have a full set of skills that will help you meet the needs of your individual communities, which are all different. So we have Psych MPs practicing in all 50 states. And although there are certain differences in scope of practice from state to state, your education, your training, and your learning will adequately prepare you for entry into that. Some states right now have a supervisory relationship, meaning that you have a supervising physician. Some states have a collaborative relationship to where you can collaborate with a physician, but maybe that physician doesn't like directly supervise you. And then you have some states that have independent practice that doesn't require physician involvement. That just varies on your individual state, but you can rest assured the education that you get here at Frontier will help prepare you for entry into practice where you live. A few of our achievements in history, I said that we've been around for a while. Frontier has about 100 years of experience in nurse midwifery and family care. And we have students and alumni throughout every state in the country. Right now, we have more than 2,500 students, and we have successfully graduated over 10,000 people that are now out in these 50 states providing care to their communities. So over the years, we have really developed a nice, significant footprint across the country to help meet the needs of the communities that we serve. I want to touch a little bit on certification. Once that you get finished with your program, the next step is you sit for a certification exam that results in you receiving a National Advanced Practice certification. We recently got the results back from our accrediting bodies, certifying bodies that gave us kind of a report card on how well that our students did on this exam. And I've got some of those listed here. And so over the past 3 years, that's what this was based upon. 99.17% of our MSN students passed that exam on the first attempt. 96.92, almost 97% of our postgraduate students passed that exam on the first attempt. And that's pretty good, I think, because if you look at the national pass rate for that exam, it's roughly about 90%. So our students have consistently exceeded the national average in all domains of that certifying exam. And so when I say that you will be prepared to enter into practice after you get done with your education here, that is really something that I mean, and not just something that I say. Our graduates are very respected throughout all of their communities, and we get feedback all of the time from preceptors and clinical sites that talk about how well prepared our students are. So you can rest assured that you're engaging in a quality, high quality, rigorous program. And along with that, we talk about student support. Regional clinical faculty are the faculty members that will oversee your clinical experience when you start clinical. They oversee your clinical hours. They meet with your preceptor. They come out to visit you in your site. And they also maintain good communication with your preceptors. So both your preceptors and your clinical faculty play a very important role in your education. Academic advisors, clinical advisors, they play a very significant role in your education. These are the people you get to know these individuals very well. And I'm in meetings all the time with academic advisors, clinical advisors, and they know students on a first name basis. And again, that just speaks to the fact that we like to know who our students are. We also have online student mentoring groups that you can take advantage of to just receive more support. We have financial aid and offer scholarships. We have a very robust library service. And then we also have student interest groups that come out of the DEI office. Um, and so, again, like I said, that is very important to everything that we do. We also offer an annual diversity impact conference that is very well received and well attended each year. Preceptors, students, providers from all over attend that each year. So we really do have a lot of things going on in the background. A little bit about our scholarships. Scholarships become available during the spring and fall terms. You do have to have a minimum of 24 credits earned, however, to qualify for a scholarship. There is a GPA requirement as well, 3.25 or higher. And although we offer several different types of scholarships, the amounts of the scholarships may vary depending on what type of scholarship it is. But we have over 20 different scholarships that we give out. In fact, in the year 2024, we awarded nearly $1.7 million to students in scholarships. And so we want to be able to support you as you go through. And I know this scholarship funding is very important. Makes a huge difference in students' lives. So that's something that we do really take a lot of pride in. I'm going to let Ms. Boyd talk about clinical outreach and placement. She can give you some really good information about this.
Thanks, Dr. Scaff. So I'll just tell you, I know Dr. Scaff has talked about the level of support that we provide to students throughout your entire time at Frontier, but I'll let you know a little bit more about specifically our department. We have 4 clinical advisors in our department currently that work one-on-one and in small groups with students. And we also have a full-time person and myself that are dedicated to helping procure clinical site agreements with clinical sites all over the United States and also procure new preceptors into our preceptor database. So we have a pretty robust team that helps support 300 students every 12 weeks in clinical, and we're really proud of that. Essentially, what we will do is we meet with you at Frontier Bound in a large group and get to talk with you in that general overview and kind of a broader sense of what to expect at Frontier in terms of identifying your clinical sites and your preceptors, and really talk about how you, as a Frontier student, get to individualize your clinical plan for your clinical experience. That's one of the things that we really take pride in at the school, is that you're able to really, depending on where you live and what type of practice you envision being in as a practitioner when you graduate, can kind of customize some of your clinical plan. And so we talk with you about that, but specifically, we want you to be able to meet all of your clinical hours and be able to obtain all of your required visit types during your clinical courses. So we talk a lot about that and just really the best ways for you to be able to find appropriate sites and preceptors. Once you leave Frontier Bound, you go home, you get started with your coursework online, and then that's when you'll be hearing from us a little bit more through email, through Zoom meetings, and we'll be talking with you about how's your progress, and let's check in and see how things are going. We have about a third of our students that come to Frontier and they already know where they'd like to rotate and where they'd like to complete their clinical hours. And that's great. That makes life really easy. But we have about a third of our students who come in and they don't quite have that yes yet. And the last third of our students come in and they're not really sure where they're going to rotate. They know that they may be moving during their didactic portion, or there's some maybe they're new to the area and they're not familiar with that area. So we work with students in all situations to really think about the best ways to obtain those sites and those preceptors. I see Jaleesa has a question, so I'll touch on that here in just a second. So I have your question and I will answer that. The other thing that I want to recognize is with our team as we are here to support you, and we also work in concert with your regional clinical faculty members. That's just to make sure that you have kind of all your ducks in a row and ready about 6 months before you start your clinical term. So it's a pretty well-oiled machine. It takes a lot of people to be able to help our students with their clinical experience, but our students really, once they have identified those sites, they're raring to go, come back to Clinical Bound, and then get started with their clinical experience. So we have a really fun job working with you all. It can be challenging, but it's very rewarding, and we love helping everybody put those pieces of the puzzle together to get their clinical plan. So, Jaleesa, I'm going to say, do you find that students are having to pay for preceptors? What we're seeing is it's across the board. You know, we don't encourage our students to pay preceptors. We encourage students, if they do find a site or a preceptor that would like payment, that they reach out to us first to have that discussion. So we will do our best to use our clinical database to be able to help you find sites and preceptors that are not necessarily charging a rotation fee or an hourly fee for precepting. We can't guarantee that, but we also let students know that we have an honorarium, that it's a small payment for preceptors. And so sometimes students aren't aware of that and our preceptors aren't aware of that, and that really helps. So you know, it's really dependent on the region and kind of where the students are, but we do our best to help minimize any direct costs that you all would feel like you would need to incur in order to get those clinical hours. And then Carrie had a question about the telehealth hours, and yes, there is some capacity for you to do that. And I'll put a link in the chat so that you can take a look at that, Carrie, on your own time. And just know that we're here for you. I will put our general email address in the inbox so you can send us questions about identifying sites and preceptors after this session, and we're happy to answer those questions for you in email or jump on a quick call with you. So let us know if you have questions. Thank you, Dr. Scaff.
Thank you. Okay. Just a little of our achievements that we have gotten over the course of the last few years. FNU is a national leader in DEI and a 7-time winner of the Insight into Diversity Higher Education Excellence and Diversity HEED Award. We're also recognized in 2021, 22, 23, and 24 as a great college to work for. FNU has also received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education. And also FNU was named the Academic Honoree for the 2024 Healthy Work Environment Award presented by Sigma Theta Tau International Honor Society of Nursing. So just a few. These are not all of our accomplishments, but they are some that we're really proud of. Now let's talk about our degree options here. What do we offer? So we offer an MSN program, an MSN degree, where you have a bachelor's degree and you want to come and be an advanced practice nurse by getting a Master of Science in Nursing degree. We also offer a postgraduate certificate. This particular program is for advanced practice providers that are already nationally certified in some area. So they have at least an MSN, maybe a doctorate, but you want to come back to get a postgraduate certificate as a psych nurse practitioner. So we have the MSN and the PGC both. Frontier Nursing University also offers a Doctor of Nursing Practice degree as well. When we look at our time frames here, we operate on a term system that consists of 11-week terms. There's a 2-week break between each term. So we have 11 weeks and then there's a 2-week break. Now, I will say when you get to clinical, That break may or may not be there. It's just depending upon how that you are progressing through your clinical hours. We find that some students don't really want to take a break for 2 weeks, but they just want to keep going in clinical so that they can continue to get those clinical requirements satisfied. And that's fine. So you can progress seamlessly through your clinical experience if you want to. In fact, that's probably what most of our students do. In the didactic coursework, there will be a 2 week break after the 11 weeks. The MSN, it takes roughly 2 to 3 years. We do have a full-time plan of study, and we also have a part-time plan of study. So 2 to 3 years. And then the PGC certificate, you can get that in about 16 to 24 months. That's kind of what you're looking at for the psych program. The DNP here, it says about 18 months. I think they have different plans of study for the DNP as well. And of course, your timeline to completion is going to depend on how many credit hours that you take each term. So if you have questions about the DNP, there's a really good website page on the Frontiers site that you can look at and get more information about that. Does anybody have any questions about the degree options at this time? Okay. So we offer MSN and PGC. Admissions criteria. Let's look at that. So you have to be an RN, of course, with a current active license, a bachelor's degree in any field, a 3.0 cumulative GPA from the highest nursing degree earned, good academic standing in your prior educational work, and 1 year of RN or advanced practice experience. That's really the admissions criteria for MSNs and the PGC students. Speaking of PGCs, this is a good segue. So with the PGC students, like I said, the postgraduate certificate student is already an advanced practice nurse. You just want to come back to get your psychiatric nurse practitioner certification. And so the admissions criteria is largely the same as what we see with MSN students. Still that 3.0 cumulative GPA, a master's degree or higher in nursing because you're already an advanced practice provider, and you still have to have an RN license that's current and active. With the PGC, to be eligible to come into the Psych PGC program, you have to be an advanced practice nurse in one of those specialties that we have listed there, like adult nurse practitioner, nurse midwife, FNP, adult gero, primary care nurse practitioner, and so forth. So you have to be already in the advanced practice role to be able to come into the PGC program here at Frontier. There is one thing that I would like to just point out on the bottom left-hand side here. There's an asterisk that says, due to state regulations, FNU suspended applications to all programs except the DNP from residents of New York. So what does that mean? Okay, so if you live in New York, you can participate in our program. You just can't do clinical in New York. And that's because the New York State Board of Nursing has very limited availability for out-of-state schools. And so we have had students that come through our program in New York. They just have to do clinicals in another state. Like, for instance, I had a student one time that lived in New York, but she done clinicals in New Jersey. And so that's something that you'll hear more about, I think, as you kind of progress through this process. But if you do live in New York and you have further questions, please reach out to our admissions team because they can really give you some good guidance and talk more about that. Okay. Richard, do you have anything to add to that?
No, you were exact in that. As long as the student has an active RN license and the state we're going to be conducting clinicals, a New York applicant, they could apply, be admitted, but as you stated, they have to do clinicals outside of the state. And I could post some information in the chat room as well.
Okay. Thank you, Richard.
Yeah, thank you.
So let's talk about application deadlines, upcoming deadlines. So April 2nd is the deadline if you want to begin studies in the summer. Coursework begins July 7. So if you wanted to apply, April 2nd is the application deadline for that cohort. If you are looking more of a fall term start, coursework begins October the 6th. The deadline for that cohort is June 25th. Okay, so those are some important dates to kind of look at. Um, Application steps. We really tried to make this seamless and not cumbersome at all to you. There's an online application. You will do an essay, a resume. You get your transcripts. The portfolio for non-BSNs, that is related to maybe you have a bachelor's degree in something other than nursing. You have an associate's degree in nursing, but let's say you have a bachelor's degree in psychology. Um, if you we have a good number of students in those type scenarios that apply to our university, and when that happens, basically there's a portfolio that you kind of develop, and you speak to certain things like how research has contributed to your nursing practice. Tell us about some leadership things. And so basically you put together this portfolio, and then that comes to me to look over. And then that goes to the admissions committee. So we have a good number of students in our program that do have bachelor's degrees in other areas besides nursing. They have an associate degree in nursing, and they do very well. So if that is your case, please don't let that hinder you from thinking about applying for admission, because we do have a lot of students that are very successful that come in that way. Tuition, currently $733 per credit hour. Richard, I'm going to rely on you again to see if I've forgotten anything about the admissions process.
Yeah, indeed. So there's the application, there's a $50 application fee associated with that. And then the documents that students submit for review comprise of a current resume, there's the mission essay, an active bar license, some documentation to support that showing unencumbered in the United States, and then all official transcripts for all completed nursing degrees. So if a student had a BSN and possibly an associate's, those are required for the application process. And I'll include that information too in the chat, but those are the essential requirements to move forward with an application.
Thank you, Richard.
Yeah, you're welcome.
Any questions about that? Okay. So let's talk about the clinical experience. So there is a required hours thing that you have to satisfy when you get into your clinical practicum. Everybody has to complete a minimum of 750 clinical hours, regardless if you are a master's student or you're already an advanced practice nurse, but you're coming in as part of our PGC program. Both have to complete 750 clinical hours. Now, this is not necessarily a frontier thing, but this is more of like a national standard that our accrediting bodies are moving toward. So as we get more into this, we're going to see schools of nursing, specifically advanced practice nursing. This is pretty much going to be universal. Many schools are already here. It's been endorsed by our accrediting agencies, and this is where we're at right now. So this is not necessarily a frontier requirement. It's just something that we have responded to as a result of national accreditation standards. So there's 750 clinical hours that you will complete in our program. Just some important people that you will get to know very well as you enter into the university. You know me now, but Dr. Susan Piper is at the bottom right-hand side of the screen. We also have course coordinators and course faculty that you will get to know very well as well. Like I said, our didactic courses are front loaded, and each didactic course has a course coordinator that really kind of manages the course. They do teaching as well, but they kind of coordinate the course and they manage the course. And then there's course faculty as well. So there's more than one faculty member in each course. And we do that because we want to make sure that we have enough faculty in a course to deliver a high quality interactive education. Like I said, we like to interact with our students. And so you will get to know the course coordinators and the course faculty pretty well. The regional clinical faculty members, they come on scene when you're doing your clinical practicum work. You meet with your regional clinical faculty at least every 2 weeks once that you get into the clinical practicum, sometimes more. And then your regional clinical faculty will come out to your site. We do a preclinical site visit, meet with your preceptor. We meet with you every 2 weeks while you're in clinic. And then also we come out for a mid-clinical site visit as well when you're about halfway through your hours. So again, you can kind of see that we are involved in your education. Your academic advisor, your clinical advisor, they are invaluable. Like I said, they offer such a tremendous service and there's such a great support system for our students. And they really want to hear from you. And like I previously said, they know students by their first name, and they know them very well. So they're very interactive and engaged. Financial aid officers, you will get to meet those people at Frontier Bound as well. And then we have credentialing coordinators. The credentialing department really oversees contract negotiations between sites and the university. That's how that your sites get credentialed and so forth. So we have an entire department that works on that for you so that you really don't have to worry about it. Once that you submit that site, your regional clinical faculty member will approve it, and then it goes off for the credentialing folks to do their job in touching base with the site and getting contracts. So they play a very important role as well. Here is a few pictures of our new campus in Versailles. We're really proud of this campus. We moved in right around the time of the pandemic. So we were a little bit slow in getting students in, but we just love our campus. It's really beautiful. It has a lot of things for you to do while you're on campus. We have several walking trails. If the weather is nice, you can just kind of take those trails and walk and look at nature. We have a reflection center that's open 24/7 if you just need some quiet time to reflect and practice spirituality. We also have a dining hall that's open 24/7. You can just come in and out and help yourself with food, snacks, drinks, whatever. And then we also have a 24-hour fitness center in the bottom of the dining hall that's open as well that you can take advantage of. We want you to be able to learn during the course of your days here, but we also want you to be able to network, make friends, and establish relationships in the evening times. That is just as important. What we really find is when students come on campus, they make friendships and establish relationships that last long after graduation. And that's really important. That's something that we want to do is we want to build the Frontier community. And I tell students a lot during that orientation week, once that you're part of the FNU community, you're always part of the FNU community. So we really want to take some time and foster those relationships. And we make sure that you have good time for that in the evening hours. There's also, I don't think you can see them here in the pictures, but we also have some gas fire pits that are outside. If weather permits, you want to just go and just relax with some of your friends and colleagues in the evening hours. It's really nice to just really sit back and sit by one of those. So we also have those. Any questions about the role of the psych nurse practitioner? We've talked a lot about the university and the program, but does anybody have any questions about what a psych mental health nurse practitioner really does and what that entails? Okay, really good. If you think about questions after we leave here, you can always email us. We're more than happy to get your questions answered. Any admission questions?
Dr. Scaff, I see a question from Jaleesa about statistics on graduates and job placement.
Let's see. Oh, yes. Thank you, Jaleesa. So varies by state, but any statistics on graduates that find job placement? I only ask because I see a lot of oversaturation, although there is a need for mental health providers. That's a great question, Jaleesa. And you're exactly right. Overall, there's a mental health shortage across the country, right? But in certain geographic areas, maybe that shortage is not as pronounced. And I think that is important to kind of look at. I recently read something in an article that said this was primarily geared toward rural and underserved communities, but there were approximately 400 people to one provider nationally, if you look at those areas. And so even though that some places, are not looking at like a very serious scarcity of resources, they have more resources than other places. I don't really think that students have problems finding jobs. We do touch base with our alumni pretty regularly after graduation, starting about a year out. And we don't really see that theme. I don't have the exact statistics to give you, but I don't really think that that's a problem because we meet with our alumni people all the time. And job placement is never something that we hear students being challenged with. And I think actually too, part of that goes back to the evolution of the role. As the years have went by and as our role has evolved, Psych MPs are working in more diverse venues, really. We see Psych MPs working in outpatient clinics. We see them working in hospitals. We see them working in emergency departments, the school system, the legal system. There's lots of different places that Psych MPs work now. And that just kind of speaks, I think, to the fact that our profession has grown. I did recently also see something out with the Federal Bureau of Labor and Statistics that talked about the job outlook for Psych MPs is much greater than some of the other areas in the healthcare field. So I really don't see the shortage as affecting students as really a problem. I know I didn't give you statistics, but I hope that kind of helped answer your question. Any other questions? Clinical placement questions, I think Stephanie went over those pretty well. The message that I really want you to hear when it comes to clinical placement is you are not alone in finding clinical placement. We want to help you. It's really important for you to begin that search early because some places do have waiting lists, a year out. And so it's not really something that you can start doing the term before you come to clinical bound. But you really do need to start your clinical search early, but we're here to help you. We have a community map that really consists of all of the sites and preceptors that we have used or currently using. And you can kind of search that by community and geographic location. And you can kind of see what we already have going on in your own community. We have that. Clinical advisors really have a big part to play because they've developed relationships with students over the years and they know, where some students have been to clinical. And so they're a really good resource as well. Your regional clinical faculty, they're a great resource. We try to regionalize where our faculty are at in the country, because we want them to be able to have a working knowledge of what the landscape looks like in your area. So they're a great resource as well as helping to, obtain some clinical placement. The key is just start early, and we want to help and partner with you in this process. You're not alone in this. Okay. This is a quote that I like to always put in here by one of our students. Success doesn't come to you, you go to it. Any final questions that you may have for us?
I see Jenny had a question about how do students keep their book knowledge current for boards during their year of clinical work? Dr. Scuff.
Awesome question. Very good. So remember when I talked about clinical education is different than didactic, right? In didactic education, you learn a lot of things. You go to your assessment class, you learn about assessment. You go to pharmacology, you learn about pharmacology. Clinical bound, we kind of help you put all of that together and piece the pieces of the puzzle together, so to speak. And then you go off to clinical and you're with your preceptor and you're learning how to apply all of that knowledge. Now, having said that, we know that things change quite often in healthcare, right? And a year can make a big difference when it comes to scientific knowledge and things, new advances, and so forth. We have programs within the clinical courses that really do help you stay abreast of things. We have a national software company that works with us, and basically you can take exams and you can not only get answers to your questions, but it will tell you why this question is right, why that question is wrong, and it will give you a percentage, like a benchmark of where you stand with other students across the country that answered that same question. That's one way that we can really help keep your knowledge and stuff up to date. The other thing that happens during the clinical courses is you will have assignments in the clinical courses. Where you will have to go to the literature, you'll have to go to the databases, and you complete some things. And so when you get into the clinical courses, even though the main function of the clinical courses is to be in clinic with your preceptor, learning how to apply some of this stuff, your faculty members are still actively involved with you, and you will still have some assignments. Now, those assignments are not going to be like what you had in your didactic courses. These are all about application of that stuff. So it's a little bit of a different lens that you see things through, but you work to increase your understanding of how this information is applied. And we have assignments built into the courses that force you to go out and take some deep dives into the literature and look at things. We also, provide a lot of education on how to navigate databases and which databases are good for which types of things, and how do you kind of triage some of that information and things like that. So we do a lot of that in our clinical courses as well. I hope that answered your question. Okay, I see Wanda has a question. Richard, could you speak to the wait list and how that kind of functions?
Yes, yeah. So in regard to the wait list, let me see the specific question. So it is a possible outcome. I personally am not privy to how the admissions committee, faculty and all those involved in the process score applicants, but it is a possibility that a student's waitlisted, and I could post some information on a waitlist fax. I just don't have particulars on the turnaround time. A student could be on the wait list for as close to 2 weeks to frontier bound, but without me over informing too much and without the exact intel of the circumstance, I could post that information in regard to the wait list if that'd be helpful, though.
Yeah, that'd be great.
And then I guess on that same note, I'm going to post the information for admissions if anybody has further questions or just needs guidance, because our information and the contact number is 859-279-0890. And then the best email address for admissions is fnuadmissions@frontier.edu. So if there's questions or folks need help after the fact, certainly don't hesitate to reach out.
Thank you, Richard. Well, again, we really appreciate you taking time out of your day to spend some time with us and talk about our program, our university. Um, I hope that I've kind of sent the message about our university that we want to partner with you in your education. We want to be more than just a faculty member. We want to be a colleague and a mentor, and we want to build that sense of community. That's really what we're all about. And I appreciate you taking time out again to be with us. Stephanie, do you have any closing remarks?
No, I just think there were great questions, and we are so glad you were here tonight. And we hope no matter which path you take on your journey, that we're able to help you. If you come to Frontier, we look forward to seeing you on campus.